So our second speaker for this closing session is Mr. Haroon Qassim. He is the Managing Director of PharmEvo and Shield Corporation. And topic for his talk is Reshaping the Future of Public Health. Mr. Haroon Qassim, please. And this will be followed by our two international speakers, Douglas Corley and Joe Wilson. Joe Wilson is especially here from California, and he's here to share his closing keynote. Thank you.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, colleagues sitting here. Since this is going, I think, on the social media, so good morning to people who are on the social or on the Facebook, and good morning, good afternoon, or good evening, wherever they are. And a big round of applause for all of you, sitting at the closing session. I see half the hall is filled. It's not a bad situation. Asfar, thank you for having me on this. And let me tell Asfar that this is the first time ever speaking in this conference. So I hope he remembers me again. So if I have my presentation on the screen. Okay, a difficult subject, public health. We all know we are going through this corona, the COVID. And actually, yesterday, was November 18th, and we celebrated the anniversary of COVID-19. So congratulations, people sitting here who have gone through the COVID or still waiting that they will go through the COVID. So let's see how it goes. It all started in China, as we all know. And so now the vaccines are there, so we'll see how things proceed. So my subject is the future of public health, which is of significant importance to all of us. We are the citizens of this world, and the public health matters a lot. So let me dive into the presentation. As usual, all the presentations begin with the definition. So the Center of Disease Control in the US, has defined the public health as the science of protecting and improving the health of people and their communities. So it includes everybody. And public health focuses on a wide variety of issues, including mental health, the racism, disease prevention, and sanitation. So as the world has grown into technology's golden age we live in today, communities around the world have become less locally confined. And further, with the modernization of preventive treatment, the future of public health has become increasingly globalized and fast-paced. So this is an interesting slide. You will see that over the last 50 years, there has been an increase in the lives of the people living in the world. So the life expectancy has increased from 30 years, less than 30 years, to over 72 years in the last 2 centuries. And we have progressed twice as long as our ancestors. So, and this progress was not achieved in the few places. We're not talking about the Western world, it happened in Pakistan as well. With the global population reaching about 11 billion in 2100, the creation of a sturdy and efficient public health system now is imperative, and not only for our health and well-being today, but for the survival of the future generations. So this is a little busy slide, but you will get to know how the public health has progressed over the last 100 years. So we are talking about public health 1.1, 2.0, and now with public health 3.0, builds on extraordinary success of our past. And it refers to a new era of enhanced and broadened public health practice that goes beyond traditional public department functions and programs. So cross-sectoral collaboration is inherent to the public 3.0 vision. So in US, pioneering the US communities are already testing this approach to public health with several from different national efforts. As I said that we are celebrating the anniversary of COVID-19, and we all saw the entire world, coming on their knees. The lockdown, the economic shutdown, the global economic turmoil, the global health turmoil. And we all saw the leadership test, the corona, which hit us last year, and we saw the trust deficit between the governments, the society, the people we all living in. The US healthcare, which is an epitome of innovation, which spends about 17% of their GDP on health, and which is the first in the OECD countries, we all saw and we are all seeing that how the US has a trust deficit in fighting this COVID-19. On the other hand, we saw a country, New Zealand, where the passionate leadership came in the front, where the trust was developed, and we saw how New Zealand controlled coronavirus and how their public followed that leadership and followed the SOPs in letter and spirit. So in my opinion, the compassion, leadership, and open communication is the key to the public health. We're still debating this deficit, trust deficit, and yesterday, the Hard Talk BBC last night, where Stephen Sakor and Dr. David Nabarro of WHO were talking about COVID-19 vaccines which just came out. And they were both talking about the trust deficit which these vaccines have brought, and people are talking about controversies behind these vaccines. And Stephen mentioned that there are 30 million plus people on the social media are discussing this vaccine controversy and how the people have a trust deficit in their leadership. For me, what is more appalling is the developed nations have their own strategy and not coordinating with WHO, which has created a global chaos. In my opinion, what should have happened, the WHO should have been in the leadership position, and all the developed countries should have coordinated with the WHO and should have fought this epidemic, but unfortunately, it's a daydream which we are all dreaming. So in my opinion, still the time is there where the Western world has to show the leadership to fight this epidemic, and hopefully the WHO and some other sane leadership can come and guide the public through this chaos. Now let's come to Pakistan, because this is where we live, this is what we breathe, and this is how we have to see how Pakistan as in the public health fare. So we are not worse off, we are not better off, we are somewhere in the middle. So according to the study, Pakistan has seen improvement in healthcare access and quality since 1990 with this health accessibility quality index increasing from 26.8 to 37.6 in 2016. So you can see that our rank is about 154th in the 195 nations as per the Lancet. Lancet is a medical journal which is respected globally. So with 200 million people of this country, more than 50% of the individuals in Pakistan don't have access to basic primary healthcare services, and approximately 42% fail to receive the health coverage. Very recently, the Pakistan Business Council, which is an organization of the big corporates of this country, came out with a Charter of Economy, which just published in last week. And they said that Pakistan is, by most account, the sick man of the South Asia. The per capita earning of Pakistan has slipped to the lowest in the subcontinent. We have 40% children who are stunted. The pandemic has exposed the critical shortfalls in our healthcare. The 44% of the children do not school regularly. And the public health, with the large, attracts many things, we're lacking basic utilities, including the safe drinking water. However, having said this, we have programs, by the recent government, especially in the KPK province, which has been a milestone in terms of social welfare reforms, which is called Sehat Sahulat program. ensuring that the unidentified underprivileged citizens across the country get access to their entitled medical healthcare in a swift and dignified manner without any financial obligations. The program's objective is to improve access to the poor population to good quality medical services through a micro health insurance scheme. We still have, as a country, basics, the communicable diseases where we are talking about smoking, obesity, and hypertension. You will see in these graphs, if you can make sense out of it, you'll see the blue line is for the males and the red line is for the females, and you'll see the dotted lines which gives you the global targets for these diseases. So you will see in all the segments, smoking, obesity, the hypertension, we as country are not faring well, especially in tobacco. You will see we are way ahead of the global targets. In obesity, we are still ahead, and same goes with the high blood pressure. So let me share some global data about the tobacco. Tobacco use kills more than 6 million per year, more deaths than HIV, tuberculosis, and malaria combined, and nearly 80% of these deaths occur in low and middle income countries, such as Pakistan, Bangladesh, India. And hypertension, which is a high blood pressure disease, is the only condition that kills more people globally than tobacco use, which is like more than 9 million people per year. So this is scary data from the public health perspective. How the public health is reshaping in the future and as we speak today. We're all talking about the digitization, the digital medicine, and I'm giving you an example of Aga Khan University Hospital of Pakistan, based in Karachi, which is one of the largest hospital institutions in this country. And they are using the digital medicines, the software, which can enhance traditional medical care and support the patient when access to healthcare is limited, which was a special need in this era of COVID. So these detection or digital phenotyping aids will not replace a doctor anytime soon, but can be a helpful partner in highlighting concerns that will need the follow-up. The good thing is in this COVID, this telemedicine, which has been there for last almost 2 decades, has all of a sudden taken pace due to COVID. And we all know that the penetration of mobile in Pakistan is quite high, which is about 32.5 million people. And when this COVID started, I remember when I was talking to the hospital, they would say, telemedicines, how will it happen, how things will happen, and we are not ready for it. And behold, later on sooner, all the big hospitals and the small hospitals in Pakistan started, telemedicines from their hospitals because patients could not, go to the hospital due to the coronavirus. So this happened, and this is going to go very fast. And all the medical professionals, the healthcare sector, the public health, will have to take the benefit of this tool to ensure that we have the healthcare available to the masses as well. Another thing which is happening in this digital world, which is virtual patients, the US Food and Drug, which we all know is the leader in the technology and bringing out the new drugs and new healthcare devices, for instance, is using computer simulation in place of human trials for evaluating new mammographic system. The agency has also published guidance for designing trials of drugs and devices that include the virtual patients. And if this would have been, really happening right now, you could have replaced real people in some stages of a coronavirus vaccine trial. For instance, it could have sped the development of a preventive tool and slowed down the pandemic. So these things are really a cutting-edge technology which, will help these pandemics to be, curtailed in the near future. So let me tell you, this coronavirus was already predicted, not in this sense, but already the global healthcare or the public health knew that there will be viruses attacking this global world. So this is not just one coronavirus which is going to stop here. There is already discussion in the healthcare or in the public health sphere that we have to be ready for the next pandemic, which can happen in the next 10 or 20 years, or it could be earlier, the way the things are progressing in this virus thing. So as nation, as public health, we have to be ready to address these pandemics, which is going to happen again and again in this world. In the technology, micro needles, which have come out in the late future, the needle, when coupled to biosensors, can within minutes directly measure biological markers indicative of health or disease status, such as glucose, cholesterol, alcohol, drug byproducts, or immune cells. So this is the technology which is moving towards commercializations for rapid, painless draw or blood or intestinal food, or for use in diagnostic testing for health monitoring. So this is something which can help address the healthcare, especially the public health sphere. Some economics data which will probably help you to understand, when we talk about public health, because if we cannot, add the public health to the dollar value or to the rupee value, then it doesn't, make sense. So if you see on the slide that every $1 invested in adding fluoride to the drinking water, you are saving $38 in dental care, and the return on investment, people who are from the finance background would understand what is ROI. It's about 3,700% in savings. The second, you will see the vaccination, that every $1 spent on vaccination or immunization of children will, with measles, mumps, rubella vaccine, saves about $16 in healthcare, and the return on investment is about 1,500%. So vaccination program prevent more than 2 million children saved from the deaths under 5 years of age, although at least another 1.5 million deaths could be saved or could be averted if the current program were expanded and new vaccines developed. So here is some hope that this coronavirus vaccine which has come out, and the 2 vaccines which have already come out, have a very positive data. And but there are still some questions which are being asked by the healthcare, but hopefully these questions will be addressed. And in the history of the healthcare, these have been the fastest development of any vaccine which has happened over the last 100 years. So thanks to the science, thanks to the digitization, and thanks to the human resource or the healthcare workers, the frontline workers, who really pushed the limits and came out with these vaccines. You'll see this a very busy slide, but I had to put it on the screen because when I read it, this was kind of music to my ears, and I'm sure you can read the title, which is the Pakistan Business Council, talking about the Charter of Economy. And if you read all the bullets, I don't know if you can find any economics or numbers in this, which is a good sign in the sense that the public health really can help the economics to expand. So you'll see this is really coming out of the business world, where the business world is looking into the public health and talking about the human health, the public health, which can save a lot, which can also bring health to the nations. So you'll see that employment, no one should go hungry because of food shortages. Expectant mothers, should have appropriate nutrition. They're talking about child stunting. So these are all the basics of public health, which an economics or a business house is talking about. So this is some real sense to the healthcare, which gives you the positivity and some optimism that we are here as nations, as people of this society, that we can really save the nation and the people of this world. This is my last slide, and the future of public health genomics is very bright, and we need to pursue it wisely. Having said this, the involvement of many parts of society, including government agencies, health organizations, NGOs, clinicians, private sector, as I just mentioned about Pakistan Business Council, and communities, we all, are increasingly important for the success of public health, and everyone benefits when people are healthy. Thank you very much, ladies and gentlemen.